Hello, welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about disc bulge and herniated disc treatment. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. You've probably heard the terms bulging disc and herniated disc before. And, chances are, you know they both have to do with something in your spine. You probably know both can be painful too, but are they the same thing? In a word, nope. While they both affect the discs in your spine, bulging discs and herniated discs are not two terms for the same condition. Your spine is made up of bones, called vertebrae, and rubbery discs stacked on top of one another, forming the spinal canal. The bundle of nerves, called the spinal cord, runs down the length of the spinal canal. The discs in your spine function like shock absorbers between the vertebrae. A bulging disc is like letting air out of a car tire. The disc sags and looks like it is bulging outward. With a herniated disc, the outer covering of the disc has a hole or tear. This causes the nucleus pulposus, jelly-like center of the disc, to leak into the spinal canal. The bones, vertebrae, that form the spine in the neck and back are cushioned by small discs. They are round and flat, with a tough fibrous outer layer, called the annulus fibrosus. The annulus surrounds a soft jelly-like material positioned in the center known as the nucleus pulposus. Discs are located between each of the vertebrae in the spinal column, and primarily act as shock absorbers as well as provide flexibility for the spinal bones. Over time, due to excessive strain or trauma, the annular fibers can weaken and tear, leaving the nucleus vulnerable to injury. A herniated disc is the term used to describe a fragment of the injured nucleus, pushing out into the spinal canal through a tear, or rupture in the annulus. The canal has limited space, which further decreases in size for the nerve, and the displaced disc fragment. Due to this displacement, the disc presses on surrounding nerves, often producing pain that may be severe. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. There are 4 stages of a herniated disc depends on the extent of displacement of the nucleus towards the outside annulus. Stage 1, Discompression. Excessive and repetitive strain, trauma, or degenerative changes compresses or squashes the disc, which in turn causes tearing of the annular fibers that hold the disc in place. The jelly-like center of the disc, nucleus, is aggravated but remains contained within the disc structure. Stage 2, Bulging disc. Continuous loading and strain on this part of the body cause the nucleus to push the annular fibers further out into a bulge, causing inflammation that can irritate the spinal nerve. At this point the nucleus is still contained within the annulus, but only because the outermost fibers are holding it in. Stage 3, Disc protrusion. The soft jelly-like material comprising the nucleus escapes from the structure through the larger tears in the annular fibers but is still connected. Disc protruding now occurs, presses on the existing spinal nerve, which in most cases causes an increase in pain, and other symptoms such as numbness, burning, or tingling sensations. Stage 4, Herniated disc. In the case of a herniated or sequestrated disc, fragments from both the annulus and nucleus have broken through the posterior longitudinal ligament into the epidural space. The fragments are now outside the segment compressing most of the spinal nerve. This is the most serious stage whereby pain levels are severe, and surgical intervention may be required. Treatment. Conservative treatment, mainly modifying activities to avoid movement that causes pain and taking pain medication, relieves symptoms in most people within a few days or weeks. In the meantime, try one or more of these treatments to help you feel better. 1. Rest. Take it easy for a few days. Rest can relieve swelling and give your back time to heal. While your back hurts, avoid exercise and other activities where you have to bend or lift. Your doctor might suggest that you rest in bed. Bed rest is fine for a short period, but don't stay off your feet for longer than 1 or 2 days. You need to keep moving so your joints and muscles don't stiffen up. You can also use ice and heat to help relieve your pain. Just place an ice pack or warm wet towel on the area of your back that is sore. You can alternate hot and cold, or use whichever feels best. 2. Medications. Take an over-the-counter pain medicine like ibuprofen, Motrin, Advil, or naproxen, Aleve, naproxen. These medicines can help relieve your pain and bring down swelling. Just don't use these for more than 10 days without talking to your doctor. When used in large amounts or for a long time, nonsteroidal anti-inflammatory drugs, NSAIDs, can increase your risk for heart problems or bleeding. Narcotics such as codeine or oxycodone-acetaminophen, Percocet, are also short-term options that your doctor may prescribe if over-the-counter meds don't work. Your doctor might also prescribe muscle relaxants to ease muscle spasms in your back, and nerve pain medicines to ease nerve damage pain. 3. Physical therapy. Some exercises can help improve the symptoms of a herniated disc. A physical therapist can teach you which ones strengthen the muscles that support your back. Physical therapy programs also include stretching exercises to keep your muscles flexible, aerobic exercises, such as walking or riding a stationary bicycle, massage, ice and heat, ultrasound therapy, electrical muscle stimulation. 4. Injections. If rest, pain relievers, and physical therapy don't help with your pain, your doctor can inject steroid medicine into space around your spinal nerve. This is called an epidural injection. The steroid can help bring down the swelling, help you move more easily, and ease pain from a herniated disc. Your doctor will use an X-ray or CT scan to find the right spot to inject the medicine. You might need more than one steroid shot to relieve your pain. 5. Surgery. Most people don't need surgery. Rest and other treatments should start to improve your symptoms within 4 to 6 weeks. But if your pain doesn't improve, surgery might be an option. Talk to your doctor about surgery if you're not getting relief from pain relievers, injections, and physical therapy. Your symptoms keep getting worse. You have trouble standing or walking. You can't control your bowels or bladder. Certain individuals may be more vulnerable to disc problems, and as a result, may suffer herniated discs in several places along the spine. Research has shown that a predisposition for herniated discs may exist in families with several members affected. Although seen more often with aging, it can happen to younger people as well. There are few if any symptoms, and early identification is only possible through medical testing and scans that show changes in a disc shape and positioning. Some may experience sensations ranging from tingling to various levels of pain, before advanced disc bulging and herniation. Early detection means that simpler treatments may prevent worsening of the condition. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.